What's up, fitness friends? Today we are going to go over how to foam roll your quads. Okay, doing a lot of squats, doing a lot of deadlifts, doing a lot of running, and these bad boys are nice and tight. Let's show you how to loosen them up by using a tool called a foam roller. Okay, we have a bunch of different tools that are technically considered foam rollers. This is the traditional one that you'll see. It might be shorter, it might be stiffer, it might have bumps on it. Whatever it is still considered a foam roller. Okay. So what we're going to do is essentially get into a plank position. Rewind. Let's basic anatomy of your quad first. For those who are not familiar, quad thigh, a lot of people call it. Okay, hip flexors attach into your quads. Quads is this big meat that runs all the way down right before your knee. When we foam roll, we want to foam roll soft tissue, aka muscle. We don't want to be rolling on joints, bones, and ligaments. So what that means is we want to hit as high up here as we possibly can without hitting any bones, joints, ligaments, okay? And all the way down to the knee before we hit any bones, joints, ligaments, okay? So to put it very simply, we are not going to be rolling onto this kneecap, all right? One more little piece. You have your big rectus femoris that comes all the way up, okay? You have your vastus lateralis, okay? So the lateral part of the quad, your VMO, your vastus medialis, oblique, this little teardrop looking guy right here. So I'm just showing you that because I'm going to show you how to hit all different parts of your quad depending on what is bothering you the most. I'll show you some different angles, but like I said, we're going to set up in a a plank position with this foam roller right in the middle of your quad. So we all know how to plank, right? So you're just like this. Remember, tight core. Okay, we're not arching the back. We're not letting it drop like that. We're staying up nice and tight. You're going to use your arms and rock yourself back, right until you hit kind of the top of the quad. We start getting into the groin area. We don't want to roll any higher. Then we're going to pull ourselves forward right before we hit the kneecap, okay? You just want to roll back and forth, okay, about 8 to 10 times, hitting the full range of that muscle. If there's one spot that's really tender, really tight, after your 8 to 10 rolls, stay on that one spot. So I'm just going to lie here, focus on my breathing in through the nose, out through the mouth. Every time I exhale, let my muscle kind of form to that foam roll and relax into there, trying to get these knots out. The blood flow and nutrients involvement and improvement to that spot. Now, if you just don't feel enough here, then you can cross one leg over, and now all your body weight is on one quad at a time. Follow the same protocols, 8 to 10 times each leg. Okay. Another way that you can do this also is now bend the knees. Now the quads are in a flex position. Okay, now you can rock back and forward. This is going to add even more benefits to that foam rolling. Okay, and then the reason I wanted to show you about the vastus lateralis being outside, VMO being in here, is now you can slightly just contort your body, slightly different, angle it so that you can really isolate that one muscle. So if I'm going to show you that, okay, this was the general abroad, right? Now see on my foot, the closest to the screen is kind of turned out. All right, and my knee is kind of facing the screen now. So now I'm going to expose the inside of that quad, the VMO. Okay, that's where you're going to be really tight, and you can just hit that one spot. And now watch my foot. See, now it turns in. All right, now I'm going to hit the outside of the quad. All right, so you can just kind of turn your knee, your leg, different directions in order to hit different aspects of that quad. But a lot of people that have knee pain, it is because your quads are tight and it's causing a lot of tension on the joint of your knee itself, all right? So if you have, some bothersome knee issues, all right, some acute injuries there, grab a foam roller, follow these instructions on how to roll out your quads. Don't think it's gonna be like magic and it's gonna happen like that, but do it a few days in a row and, keep your stretching and active rest going, and maybe you can kind of cure up those knee ailments, all right? So go out there and get a foam roller, start foam rolling, feel good, get your mobility up there, and stay safe. Happy holidays, all right, everyone? Enjoy.